being used together in the treatment of a wide variety of cancers. Now, this is the paper here. Real-world clinical outcomes of ivermectin and mebendazole in cancer patients result from a prospective observational cohort. So in other words, this was a group looking forward.
Hold up, just in case. People need to write this down. If you don't believe me, this can be pulled up. It is in PDF format. They do have it on their website. I'm not trying to put out their website right now. A lot of other things that I have that they put out, I'm not going to put on screen right now. I'm going to at least show you this part and at least show you that he's showing you this part. And I do have this one as well. This is the most recent one. Watch closely.
People joining the group and then data being collected prospectively.
And I'm going to tell you where to get everything. Meaning,
and it's written as
if you got people in your if you got people in your family that need this now, again, I'm not giving you medical advice. I'm not a doctor. I'm not a physician. I'm just here to provide information for educational purposes only. So me showing you where you can get it from is for educational purposes only.
Abstract. It's not yet been subject to full peer review, but I'm bringing it to you because it's really very interesting. And the lead author is Nick Hushler, who is actually a friend of the channel. So the full paper is there. Now, let me just give you the main points of this, and you can decide if you want to watch. So that's the reference for the paper, the clinical benefit ratio. Now, the clinical benefit ratio is something used particularly in evaluating cancer treatments. And it means that there's a complete response, or there's partial response or stability of the disease. It means it's a good outcome. Anyway, the good outcomes were 84% with a combination of ivermectin and mebendazole. Mebendazole, of course, is a very similar drug to fenbendazole. It's the human form, really, mebendazole. Mebendazole and ivermectin together giving this good result of 84% in terms of clinical benefit.
Based on what I found, it has to be ivermectin, 25 grams of that, and mebendazole, 250 milligrams of that for at least 90 days.
Ratio. So that's what this video is about. 84.4% of patients did well, which is incredible. So why isn't this being widely taken up? Well, we don't have the large-scale randomized controlled trials because they're largely done by pharmaceutical companies. Now, the paper does mention... You heard
what he said? The reason why this is... He just told you why. And look, he about to tell you how much they making. Look, he just told you why this is not being... This is live right now. Is he alive right now? Yes. Yes. Dr. Campbell is still alive. He's in the UK. Dr. Campbell is still alive. But I just need you guys to understand what he just said was very important.
About 84.4%.
As to the reason why this is basically not,
which is incredible,
on blast.
So why isn't this being widely taken up? Well, we don't have the large-scale randomized controlled trials because they're largely done by pharmaceutical companies. Now, the paper does mention the fact that overall it is estimated that annual costs of standard chemotherapies average $111,000 per year.
A money thing.
I guess that's about, what, £90,000. $111,000 per year. Now, the fact that the pharmaceutical companies are making so much money out of this may have nothing to do with the fact that they don't conduct the clinical trials into ivermectin and mebendazole. Who knows? But they're facts given in the paper anyway. Now let's look at some of the details now, because it really is quite an interesting study. So drug repurposing offers a pathway to identify accessible, this is available to anyone, this is egalitarian, low toxicity, low cost cancer therapies. Now the paper says that this therapy should cost $1,000 or $2 a year, as opposed to $111,000 per year for traditional chemotherapy. I'm sure I could do it for a lot less than that, one heck of a lot less than that. These drugs are generic, they're remarkably cheap. Before Romania joined the European Union, I used to buy a lot of mebendazole and send it to friends and colleagues in Romania for treating worm infections.
That's technically what it is. It's an anti-parasite. So, matter of fact, CNN said they considered it a horse dewormer. That was the term that they used when they were talking about this in CNN segment. They called it a horse dewormer. They were trying to throw everybody's attention away. Yes, it does get rid of parasites, but not only in animals, in humans as well. Now, they're not considering cancer a parasite, but it is. Because you got to think about it. How else is it being fed? It's being fed through that glucose with sugar, right? I mean, and it gets its energy that way. Damn, that sound familiar, don't it? That sound familiar, don't it? Look at how they've been doing this shit.
And at that time, okay, it's a while back, but I was paying £2.30 per 1,000 doses. That's probably the equivalent of £6 or £7, $10 per 1,000 doses. So these drugs are remarkably inexpensive, remarkably cheap, and have got the potential to, as we'll see, treat these wide variety of cancers. Now, Ivermectin and mebendazole have demonstrated multiple target anti-cancer activities. They work in many different ways. I do see quite a few papers by, what do you call them, fact checkers, who say cancer is not a parasitic disease. Ivermectin, mebendazole, fenbendazole can't work. Well, this paper is aware of that. We're aware of that. They are not working by killing parasites. They have multiple other biochemical modes of action, and the details of those are coming. So we know that they work in a wide variety of ways in the cells and tissues of the body. This paper evaluates real-world patient-reported outcomes, safety and adherence to a cohort of cancer patients utilising the combination protocol. And the combination was Ivermectin 25 milligrams, mebendazole
250.
Ivermectin 25 milligrams, mebendazole 250 milligrams a day for 90 days. That was this 90 days. Protocol. We're not giving medical advice, just reporting what this.
And now, keep in mind, people have seen results quicker than that. But I'm just saying, you have to take it consistently for 90 days to completely, have the full cure. Okay, and it could work in conjunction with whatever the clinic or the doctor is giving you, like if you're going through some form of chemo, and the paper gets into that. And because that's who they were running the test on, these type of patients. You about to see.
Was. The methods, so it's prospective observational cohort study, 197 cancer patients, so it's a reasonable number.
So 197 patients. Keep that in mind. 100. Y'all was on commercial. Y'all back? Hold on. Y'all want me to go back? Yeah, we good? You didn't really miss anything, I'm telling you, just in case you missed it. So 197 patients this was tested on. Y'all ready? We good?
Ivermectin and mebendazole, off-label. So this is not official sort of nice guideline stuff. It's off-label, what you might call compassionate prescribing through telemedicine by registered US providers. Participants received compounded oral capsules, so it was all together in one, 25 milligrams of ivermectin, 250 milligrams of mebendazole. I think that's what I said before, 250 milligrams of mebendazole. Mebendazole, as we've said, being a very similar preparation to fenbendazole.
Right.
Data were collected voluntary, standardized digital surveys at baseline and approximately 6 months follow-up. So these patients mostly followed up at the 6-month period. The initial cohort, 197 baseline characteristics, including cancer type and disease status, were assessed. And there's actually some really quite nice graphics in the paper here, where they show like prostate cancer was the most common, then breast cancer, then lung cancer, then colon cancer, liver cancer, and then all these other cancers as well, which in itself is really quite impressive
This is where all of those patients have.
This combination of mebendazole and ivermectin appears to be effective against a very wide range of cancers. And this means if you think about a third world situation, for example, where you don't have perhaps availability of specialist oncologists, junior doctors and medical assistants and senior nurses could potentially prescribe this for a wide range of cancers, because the treatment would be probably, as far as we know, very similar for a wide range of cancers, which is, again, very egalitarian and the sort of thing we want to promote. So various cancer types, a total of 122 patients completed, 61.9% response rate. So that's actually not too bad. Mean age 67, about half were male and half were female, so pretty well half and half. Cancer types included, I've listed them there just for convenience so you can see them in the notes. So as we've just noticed, a wide range of different cancers. Normally, of course, all these cancers would have, as I said, dramatically different treatments, whereas here it was all the same basic adjunct treatment that could potentially be given. Median duration since initial diagnosis of these patients was 1.2 years. 37.1% at the time were experienced active disease progression. So that was shown on this graphic here. So we see that at baseline we have 37.1% who actively.
So the metastasis, in other words, the metastasis, and he's probably about to say it, but that just means that it has spread, throughout the body. So the 37.1% was in the middle of. Oh, it says spreading, actively spreading or progressing. Okay, I apologize. I just saw that.
It was metastasizing. Metastasis going to different parts of the body, spreading all over the place to the bones, the lungs, the brain, wherever it the liver, wherever it was metastasizing to. Others were in a more stable situation at the time. This is when the treatment was, when the patients first enrolled on the trial. 6-month follow-up, pretty good, nearly 87% adhered to the treatment. Took the full 90 capsules of ivermectin and mebendazole prescription.
Huge number.
Not an intensive, difficult treatment to follow at all by any means. Clinical benefit ratio, as we've said. So some had complete response, some had a partial response, and some had the disease was stabilised. And again, the paper's very good. It shows this graphic of that. So we see that some patients here, the 32.8%, had no evidence of disease at the time. 15.6 had known regression and 36.1 were stable. Only 15.6% had progressed. And given that cancer is a progressive disease, I consider that result to be quite remarkable, really. Normally, of course, you'd expect 100% to progress because cancer is by definition a progressive disease. Clinical benefit ratios was at 84.4%. Right, so 48.4 of the cohort, strongest possible outcomes. Regression, 15.6%. No current evidence of disease, as I said, 32.8. Disease stability, 36.1. Only 15.6% of the whole cohort were progressing.
And again, it was 197.
Remarkably good. 87% nearly stable or improving. Now, this is very interesting indeed. I have talked to different people on this channel, Dr. Macus in Canada, for example, Gus Dalgleish in the UK, and we've talked about the dose which would be ideal for this. And basically, of course, because the trials haven't been done, we don't know. But this study, at least relatively small, but what this study showed is no significant dose-response association was observed for cancer outcomes. And the chances of that being wrong were only 9%. So it's 91% likely that is a correct statement. In other words, the lower doses, people on the lower doses were doing as well as people on the higher doses. Now, the very best response was from people with 2 capsules a day, but it wasn't much different. So it looks like the relatively low dose of 25 milligrams of ivermectin and 250 milligrams of mebendazole is as effective as the higher dose at least from this study. Now, of course, people will argue with that. All I'm saying is I don't actually know the complete answer to that, of course. No one does, because the full trials haven't been done. But that's what this study showed. It's a direct quote from the study, very interesting. No significant dose response. So I mean, normally with a dose response, you know, it's like if you give a higher dose, you get more response. So the higher the dose, the greater the response. So for example, if someone's drinking alcohol, the higher the dose of alcohol, the more they get drunk. That would be normal, but this isn't showing that. So the response was pretty well the same in this study, regardless of the dose, which is very interesting indeed, and should help to guide future studies. Without any clear dose response gradation for efficiency, encouraging that the lower doses may be effective. How low can we go? We don't know. But it would be interesting to find out, wouldn't it? Side effects, pretty mild. There were a few mild side effects reported, mostly gastrointestinal, but nearly 94% of those affected were able to carry on with their treatment. So very well tolerated. Some adjusted the doses a bit, but basically very well tolerated. Concurrent conventional therapies. Now, what other therapies were these getting? Well, of the people taking the ivermectin and mebendazole, 27.9% were on chemotherapy as well. Radiotherapy, 21.3% were on radiotherapy as well, and 19.7% had surgery during the course of the 6 months as well. And as well as that, quite a lot were on dietary supplements, nearly half, and dietary modification, just over a third. Right, conclusion. The initial conclusion from this study. In this prospective real-world cohort, the combination of ivermectin and mebendazole was associated with high rates of self-reported clinical benefit, with nearly half of participants reporting tumour regression or no current evidence of disease across heterogeneous populations of cancer patients. In other words, different people, different sexes, different types of cancer, all got a benefit, which is really quite remarkable, These findings provide a compelling clinical signal that there is well-tolerated, repurposed agents may offer therapeutic benefit. And that's the ivermectin and mebendazole may well offer therapeutic benefit. However, as the study honestly says, observational design, reliance on self-reported outcomes and potential for selection bias, that's the people that go into the study in the first place, and uncontrolled confounding variables, these findings should be interpreted as hypothesis generating. So there is most definitely a hypothesis here. The hypothesis is that giving 25 milligrams of ivermectin and 250 milligrams of mebendazole every day for 90 days has a significant benefit to a whole range of cancers. That is.
All right. Now, I'm glad you caught that I was muted, because I was talking and I was just throwing it up on screen, and I was letting you know that I was dropping the link inside of the chat. I was throwing it up on screen, showing you where you could get it from, and dropping the link inside of the chat. It says some of y'all are trying to do it and trying to, okay, look. Yeah, I did it again. I just did it again. Push come to shove, y'all could join the 13% community server, and I'll share it again. You know, and I'll do it again. The 13%, the link is in the chat. That's it. Discord.gg 13%. Okay. So, you know, but then again, you have to do your own research. You also are going to know that I'm not trying to give you medical advice. This is all for information purposes. I just want you to check things out. You understand what I'm saying? Same thing with him. Keep this in mind. This is, not medical advice. This is not medical advice. We're just providing information. This is all research based. educational purposes only. All right. You could definitely seek your physician or your doctor, healthcare provider for that type of thing. All right.
It's easy to test. Now, of course, we're not expecting this to be done because mebendazole and ivermectin are cheap. They're inexpensive. And pharmaceutical companies are currently making an average of $111,000 per year per patient. Not that we're saying that's why